Causes of Alzheimer's disease in the elderly. Alzheimer's disease is a progressive neurodegenerative disorder that causes memory loss, cognitive abilities, and behavior, primarily in older adults. The exact cause of Alzheimer's disease is not fully understood, but research suggests that it is the result of a combination of factors, including genetics, environment, and lifestyle. Here's a detailed explanation of the causes. 1. Pathological changes in the brain mechanism. Alzheimer's disease is characterized by two main lesions in the brain. Amyloid plaques. These plaques form due to abnormal accumulation of beta-amyloid protein outside nerve cells. They disrupt communication between nerve cells, causing cell damage and death. Neurofibrillary tangles. Abnormal tau fibers in nerve cells disrupt cell structure and function, leading to impaired nerve signaling. Specific effects. These changes occur mainly in the hippocampus and cerebral cortex, affecting memory, thinking, and decision-making. In older adults, this process occurs more rapidly due to the natural aging of the brain. For example, a 70-year-old person may begin to forget recent events due to amyloid plaques and tau fibers, damaging the hippocampus. 2. Genetic factors mechanism. Certain genes increase the risk of Alzheimer's disease, especially in the early onset before age 65 or late onset after age 65 forms. APOE for gene. This variant of the apolipoprotein E gene increases the likelihood of beta-amyloid accumulation, increasing the risk of Alzheimer's disease 3 to 8 times. Early onset genes. Mutations in the APP. SIN1. SIN2 genes are rare but cause early onset Alzheimer's disease age 3050, with a high rate of inheritance nearly 100% in children if parents carry this gene. Specific effects. People with a family history of Alzheimer's father, mother, siblings are at higher risk, especially if they carry the APOE4 gene. About 15 to 25% of Alzheimer's patients have a genetic factor. For example, a 65-year-old person whose mother has Alzheimer's and carries one copy of the APOE4 gene has a 3-fold increased risk of developing the disease compared with someone who does not carry the gene. 3. Aging and brain dysfunction mechanism. Natural aging reduces the number of neurons, reduces the ability to repair DNA damage, and increases oxidative stress in the brain. These changes increase the risk of abnormal protein accumulation, amyloid, and tau. Specific effects. People over 65 years old have an increased risk of Alzheimer's with age 5% at age 65, 30% at age 85, decreased cerebral circulation, and reduced brain volume in older people also contribute to disease progression. For example, an 80-year-old person can lose 10 to 15% of their brain volume compared to a 50-year-old, setting the stage for Alzheimer's-related neurological damage. 4. Underlying pathology and vascular factors mechanism. Vascular diseases such as hypertension, diabetes, stroke, or atherosclerosis reduce blood flow to the brain, causing nerve cell damage and promoting amyloid plaque accumulation. Specific impact. Chronic high blood pressure damages small blood vessels in the brain, increasing the risk of Alzheimer's by 1.5 to 2 times. Type 2 diabetes increases inflammation and oxidative stress, which contribute to neurodegeneration. A stroke or transient ischemic attack damages areas of the brain, increasing the risk of Alzheimer's. For example, a 70-year-old person with high blood pressure and diabetes for 10 years has a 50% higher risk of Alzheimer's than a healthy person. Asterisk 5. Environmental and lifestyle factors. Asterisk mechanism. Unhealthy lifestyle increases inflammation, oxidative stress, and brain damage, contributing to the development of Alzheimer's. Asterisk specific factors. Asterisk unhealthy diet. Eating a diet high in saturated fat, sugar, and low in fruits and vegetables increases inflammation and reduces brain health. Asterisk sedentary lifestyle. Lack of exercise reduces blood flow to the brain and reduces production of brain-derived neurotrophic factor BDNF, which is necessary for nerve cell survival. Asterisk smoking and alcohol damage blood vessels and increase oxidative stress in the brain. Asterisk lack of sleep. Poor sleep reduces the ability to clear beta amyloid from the brain. Asterisk chronic stress increases cortisol, damages the hippocampus, increases the risk of cognitive decline. Asterisk specific impact. Older adults who have a sedentary lifestyle, eat a lot of saturated fat, and sleep less than 6 hours a day have a 30 to 40% higher risk of Alzheimer's than those with a healthy lifestyle. Asterisk for example, a 65-year-old who has smoked for 20 years and does little exercise has more than double the risk of Alzheimer's than a non-smoker who exercises regularly. Asterisk 6. Traumatic brain injury and other factors. Asterisk mechanism. Traumatic brain injury TBI from falls, motor vehicle accidents, or sports increases inflammation and abnormal protein accumulation in the brain. Asterisk specific effects. Older adults who have had a traumatic brain injury, especially multiple, have a 2 to 4 times higher risk of Alzheimer's. Additionally, chronic infections such as herpes virus or exposure to heavy metals such as aluminum, lead may also contribute to the disease. Asterisk for example, a 70-year-old person who had a fall that caused a head injury 10 years ago may see cognitive decline sooner than someone who did not have an injury. Asterisk 7. Chronic inflammation and oxidative stress. Asterisk mechanism. Chronic inflammation due to disease or lifestyle and oxidative stress due to free radical accumulation damage nerve cells, promoting the accumulation of amyloid plaques and tau fibrils. Asterisk specific effects. Inflammatory cytokines such as IL-6, TNF-alpha are elevated in older adults, increasing the risk of neurodegeneration. Oxidative stress from poor diet or environmental pollution also contributes to the disease. Asterisk for example, a 68-year-old person living in an area with heavy air pollution and suffering from chronic arthritis has a higher risk of Alzheimer's due to the prolonged inflammation. How to prevent Alzheimer's disease in the elderly. Although it is not possible to completely eliminate the risk of Alzheimer's, especially in people with genetic factors, the following measures can help reduce the risk or slow the progression of the disease. 1. Maintain a healthy lifestyle. Brain healthy diet. Follow the Mediterranean or MIND diet, a combination of Mediterranean and DASH. Increase green vegetables, cabbage, spinach, fruits, strawberries, blueberries, fatty fish, salmon, sardines, olive oil, and nuts, walnuts, almonds. Limit red meat, saturated fat, and sugar. For example, eating 3 to 4 servings of fatty fish week and 1 cup of strawberries day can reduce the risk of Alzheimer's by 20 to 30%. Exercise regularly. Do aerobic exercises, brisk walking, cycling, swimming 150 minutes a week, combined with muscle strengthening exercises, yoga, lightweight lifting 2 times a week. Exercise increases blood flow to the brain, stimulates BDNF production, and reduces inflammation. For example, walking 30 minutes per day, 5 days a week can reduce the risk of cognitive decline by 15 to 20%. Get enough sleep. Sleep 7 to 8 hours a day. Maintain a regular sleep schedule. Sleep helps the brain remove beta amyloid through the lymphatic system. For example, avoiding using your phone before bed and keeping your bedroom quiet and dark can help improve sleep quality. 2. Stimulate brain activity, learning and memory training. Engage in activities like reading, playing chess, learning a foreign language, or playing a musical instrument to stimulate neural connections. For example, learning a new language at age 60 can slow cognitive decline by 2 to 4 years. Puzzles and brain games. Playing Sudoku, crosswords, or games on apps like Lumosity helps maintain cognitive function. For example, solving crossword puzzles 3 to 4 times a week can reduce the risk of Alzheimer's by 10 to 15%. 3. Control underlying disease management of hypertension, diabetes, and dyslipidemia. Check your blood pressure, blood sugar, and cholesterol regularly. Take medications as prescribed by your doctor and maintain a healthy lifestyle. For example, keeping blood pressure below 130/80ths mmHg and HbA1c below 7% in people with diabetes can reduce the risk of Alzheimer's by 20%. Avoid smoking and limit alcohol. Quit smoking and limit alcohol to 1 to 2 glasses a week. Red wine if allowed to protect brain blood vessels. For example, quitting smoking before age 60 reduces the risk of Alzheimer's by 25 to 30%. 4. Increase social interaction mechanism. Social interaction stimulates brain activity, reduces stress, and prevents depression, a risk factor for Alzheimer's. Measure. Join a club, do community activities, or meet with friends regularly. For example, joining a singing group or senior club twice a week can reduce the risk of cognitive decline by 15%. 5. Stress management and mental health mechanism. Chronic stress increases cortisol, causing damage to the hippocampus. Depression also increases the risk of Alzheimer's. Measure. Practice meditation, yoga, or deep breathing for 10 to 15 minutes a day. Seek psychological support if you experience signs of depression or anxiety. For example, meditating for 10 minutes a day can reduce cortisol and improve short-term memory. 6. Protect the brain from injury mechanism. Traumatic brain injury increases the risk of Alzheimer's by causing inflammation and nerve damage. Measure. Wear a helmet when cycling or working in hazardous environments. Improve the living environment. Install handrails, non-slip mats to reduce the risk of falls. In older adults, for example, installing stair lighting and removing loose carpeting can reduce the risk of falls by 30 to 50%. 7. Regular health monitoring mechanism. Early detection of signs of cognitive decline or underlying disease helps timely intervention. Measure. Get a general health check every 6 to 12 months, including blood tests, blood pressure checks, and cognitive assessments such as the MMSE or MoCA test. If you have a family history of Alzheimer's, consider genetic testing APO or brain imaging MRI. PET at early symptoms. For example, detecting mild cognitive impairment MCI at age 65 can lead to early intervention, reducing the risk of progression to Alzheimer's. 8. Use functional foods if necessary. Mechanism. Certain antioxidants or brain health supplements why help reduce inflammation and oxidative stress. Measure. Supplement with omega-3 south from fish or pills, vitamin E, or curcumin turmeric extract if recommended by your doctor. For example, taking 1 to 2 grams of omega-3 south per day may support brain health and reduce inflammation. Important note: cannot be completely prevented, especially in people with strong genetic factors, such as carrying two copies of APOE4, but a healthy lifestyle can slow disease progression. Personalized prevention. Older adults should consult a neurologist to develop an appropriate plan, especially if they have underlying medical conditions or family history. Early action. Starting preventive measures from middle age 40 to 50 is more effective.